you all on relevant topics, and the coronavirus pandemic hit, and this was the perfect opportunity. We know that there's lots of questions and issues folks have on how to deal with this issue at your district, and so we have pulled together some folks from our firm to try to go through a few of the more relevant topics that we think might be of interest to you all. Today on the phone, we're going to have several folks from Lewis, Longman, and Walker. We serve as the Florida Association of Special Districts General Counsel and Legislative Counsel. On the phone, well, on the video conference today, Terry Lewis from our West Palm Beach office, Jim Lynn and Glenn Thomas and myself from the Tallahassee office, Seth Bain from the West Palm Beach office, and Nicole Pote from our St. Petersburg office. They'll each be going through a few different topics. I think first off, what I wanted to do was sort of update everyone on where things stand currently in Florida. You've all probably been watching CNN or Fox News or your choice of cable news networks. So you're getting the national and the international stats, but I thought it might help to bring it home to Florida, where we currently stand. And all of these numbers that I'm going to give you can be found on the Florida Department of Health's website. It's updated twice daily at 11 a.m. and 6 p.m. As of 11 a.m. this morning, there are 20,601 total cases in Florida. The total number of deaths in Florida is at 470. There have been a little over 175,000 tests administered in Florida, resulting in a positive diagnosis in 11.7% of the tested people, for a total of 20,601 cases in Florida. Most of those are residents. Only 566 of those are non-residents. And total hospitalizations in the state as of 11 a.m. this morning are 2,694. The good news, I suppose, is that currently our hospitals are reporting that they're only at about 43% capacity. So if in fact we do see a surge that some have predicted, there's still more than half capacity left in the hospitals to hopefully absorb those new hospitalizations. And then hopefully as some of the people transition out of the hospitals, that frees up capacity as well. So that's where we stand, just hard numbers reported twice daily from the Department of Health. Backing up just a little bit, sort of give you all a timeline of what's occurred nationally and in the state. Back on March 9th, Governor Ron DeSantis issued Executive Order 51 for the year 2020, declaring a public health emergency. A week later, March 16th, President Trump and the Centers for Disease Control issued their 15 days to slow the spread initiative, which we now know is called social distancing, their recommendations to distance from folks.
All right, it looks like Chris lost a little bit of service. I know that due to the fact that we have about 80 participants.
Shortly after that.
Oh.
Yeah.
Hey, Chris, this is Kelly. So typically we have about 50 participants on this WebEx, and today we have about 80 people. So I believe that that is taking a lot of bandwidth. So we're having a hard time hearing Chris. What we can do is turn it over to Nicole and Terry Lewis for their portion of the presentation, and then maybe we could circle back to Chris once he comes back.
Okay. Yeah, Nicole, do you want to go first?
Yeah, Terry. Kelly, do you think it would be helpful if we don't have our video on? That might help with bandwidth.
It may. Yeah, you can go ahead and just present with the audio and not the video and see if that is how that works.
All right. Well, good.
All right. I have muted mine or taken it off.
Okay. Well, good afternoon, everyone. My name is Nicole Pote, and I am out of St. Peter's office. And Terry and I are going to speak with you about sunshine law issues and COVID-19, including Executive Order 20-69, virtual meeting tips and considerations, and information on essential services, including Executive Order 89 and 91. So to start, I'm going to talk about Executive Order 20-69. So on March 20th, 2020, the governor issued Executive Order 20-69. And what this order does is that it suspends any Florida statute that requires a physical quorum be present and that requires a specific location for a public meeting. It also grants local government bodies the ability to use virtual technology to conduct meetings as provided in Section 120.54, subsection 5B2, which provides some guidance on how to host a virtual meeting and some of the requirements for state agencies hosting virtual meetings. And I will note that what Executive Order 20-69 does not do is that it does not suspend any of the traditional sunshine law requirements, namely that meetings need to be open to the public, reasonable notice needs to be provided to the public, and that minutes be taken. So the question then becomes, if you are going to have a virtual public meeting, how are you going to meet the standard tenements of the sunshine law? And I will say that the first step in the analysis should be, do you have to have the meeting? Are there legal requirements making you have the meeting? Is there any way to disband with those requirements? And if there's not, is there any way to limit the scope and agenda of the meeting such that you're only really dealing with critical issues that have to be heard, that can't be postponed or held off until a later period in time? So once you've made the determination a virtual meeting is required, there are some considerations that you need to look at because having a virtual meeting is quite different than having a meeting in person. And how you're going to, go about keeping it open to the public, providing notice is going to be different than your standard practices. So one of the first things as far as, allowing public access to the meetings, some things you want to consider are, are you going to allow public comment? To what extent are you going to allow public comment? Are you going to have the public submit questions beforehand, which I know a lot of local governments have done. Some other things that have been done is they'll have a telephone line being monitored by staff so folks can call in and ask their question. Live streaming, of course, of the meeting is also something else that's been done, and some other considerations, closed captioning, and how are you going to provide access if folks don't have a computer? Are you going to have something available, at a public building? What are you going to do to provide access and meet all of the requirements that still have to be met even during these testing times? And then the other major consideration is notice. So there's no waiver of the notice requirements under the Florida statutes, and your notice is also going to be a little bit more complicated because you have to do it pursuant to 120.54, which, you're going to want to include information about how people can public comment. You're going to want to include information on how they can participate and how they can get assistance either before the meeting or during the meeting, or if they have special needs or something to that effect, helplines that they can call, etc. And so what we've done is we've actually provided a template notice of a special electronic meeting to FASD. So if any of you on the line haven't received a copy of that, or you'd like to receive a copy of that, that is available. And a question that some some special districts have been asking is, 189, Chapter 189 of the Florida statutes requires that certain notices be advertised and published, and we are recommending that yes, unless it's completely impossible, that yes, your notice still needs to be published. 189.015 provides for cases of a bona fide emergency, which I think this would be considered that if your meeting is dealing with that emergency and specifically, you can hold off on advertising. The meeting still needs to be noticed, but you can hold off on the advertisement as long as the action that's taken is subsequently ratified at a meeting, published, and noticed pursuant to the statute. So the next thing, of course, is the next consideration is how are you going to preserve, what's gone on at the virtual meeting, and if you're having folks comment, how is your recording secretary or your clerk going to keep those records, preserve those records? And so those are all things that need to be looked at. And with that, I think one of the biggest tips is if you are going to have a virtual meeting is to practice beforehand using your platform, whether that be Zoom or WebEx or one of the other numerous platforms out there, so that when the actual meeting date rolls around, you feel more comfortable with it. And as part of that comfort level, another resource that we've provided at FASD is a remote participation checklist, which kind of walks through, like, have you noticed the meeting, and all of the different things that you might need to consider during the meeting. And then the other resource that we've provided is a script for conducted meetings, which I think will be very helpful to your board members so that things aren't forgotten, because it's easy when you're, it's hard, you might not necessarily be able to see your fellow board members. You need to make sure that, the vote, if the vote is going to be taken, like what each person is voting on, and so a script helps with that. And so that is another resource that we've provided. And with that, I guess the next question is, can you still do in-person meetings? And I'm going to turn it over to Terry so that he can talk to you a little bit about that and then talk about essential services and the executive associated with that.
Okay, thank you, Nicole. Let me clear my throat here. Can you have, in-person meetings? With some limitations, the answer is yes. On that, there are a couple of cities here, and I'm in Palm Beach County, by the way, that have essentially delineated areas within their meeting hall so that people can only sit, within, at least, they have to be at least 6 feet from each other. So one of the cities has basically eliminated every other aisle with that. That can be done. Most everybody, however, is going to virtual meetings. And as Nicole said, the people that we work with and for that are with FASD have taken some of the materials we've provided, and they're fairly extensive guidelines for what you need to do to set up a virtual meeting. But it can be done, and it's basically getting simpler every day as we get a little bit more experience with it. But those meetings can be held. In fact, I witnessed one last week that was sort of a semi-virtual meeting where 2 of the city council members were present, but the other 3 were remote. It was noticed that way, and I believe that was one of the cities that allowed the public to come in if they wanted to, with limitations on requiring them to distance each other by 6 feet or more. That is that. You know, my primary purpose is to cover what have been denominated as essential services or essential activities. The history of this is starting in March 1. In Florida, the Department of Health, was directed to issue, a public health emergency. And March 1 was when that occurred. On March 9th, the governor issued Executive Order 52, declaring the state of emergency for the entire state. And following that, the president on March 16th issued, along with the Center for Disease Control and Prevention, the 15-day order to slow the spread by social distancing, and other mitigating activities. That has since been extended. That order has been extended to April 30th, and a series of other events have occurred or actions. On March 19th, the Miami-Dade issued their executive order 7-20, that declared the emergency for all of Miami-Dade County, and that essentially identifies essential essential services and activities. If anybody does want the executive order, by the way, and the Miami-Dade order, I'll be happy to provide those if they simply email me. I do have them up and can transmit them to you electronically. For what it's worth, the Dade County order lists 34 different categories of occupations or activities that are essential. You can go on and look. Within every category, there are numerous subcategories. You're probably talking about, more than 100 different businesses, are deemed essential. The only ones I can think of that haven't been deemed essential are things like barbershops and beauty shops. Most everything that you could think of, is deemed essential, by Miami-Dade and, by Executive Order 89 of the governor by the entire state of Florida. So that is where we are with that. The next order, Executive Order 91, deals, let me back up on this. What I was talking about with Executive Order 89 only covered Palm Beach, Broward, Dade, and Monroe counties. Executive Order 91 covers the entire state of Florida, and it does some additional mandates. It directs the senior citizens, which is anybody over 65, or individuals with a significant underlying medical condition, to stay at home, to shelter. Underlying medical conditions, examples given are things such as chronic lung disease, moderate to severe asthma, serious heart conditions, diabetes, obesity, renal failure, the kinds of things you would think of. The order then goes on to identify essential services, and it identifies essential services by reference to the guidance issued by the U.S. Department of Homeland Security. In addition to the items that were identified in Executive Order 89 for the 4 southernmost counties, which I should add, by the way, account for more than 60% of the infections in the state of Florida. But the huge number of essential services identified there are additionally identified or expanded, by Executive Order 91. It incorporates the 18 categories, of essential services that have been identified by the Department of Homeland Security. That each of those categories within the category, has scores, of specific activities or specific services that are identified. Some essential activities identified by the order itself include attending religious services, participating in recreational activities such as walking, biking, hiking, fishing, hunting, running, swimming. You can also take care of your pets, and you can care for a loved one who may be ill with the disease. The governor reserved the right to add other essential activities as well. In where I live here in Palm Beach County, the additional self-help activities that have been undertaken by businesses that remain open, such as grocery stores, or Home Depot or Costco, they encourage everybody to wear a mask, and it appears that 90% of the people that go to the stores like that are actually wearing masks now. The companies have marked off 6 feet departures, 6-foot areas with X's, all along the sidewalk, so that people waiting to get in can distance themselves a full 6 feet. In the case of Publix, and I believe, Home Depot as well, there's one way in and one way out. An employee of the companies sit at the entrance door, and you do not go in until somebody that is inside comes out, so that the number remaining in the store is constant, and it's easier to distance yourself from one another while you're in. In the case of Publix, they have actually turned all of their aisles into one-way aisles, so that when you go in, you basically have to follow the arrows that are on the floor. And if you're going to cover the whole store, you end up covering it in a serpentine fashion. So those are the things that are happening. And, that's, again, I'll make the offer. If anyone wants copies of the executive orders 89, and 91, along with the attachments I mentioned, let me know. Let Fred Crawford with FASD know, and we will see that you get them. And at this point, I will defer on to the next speaker.
Hello, everyone. This is Seth Bain. I'm out of the West Palm, Lewis, Lomner, and Walker, along with Terry Lewis. And I wanted to speak with you a little bit today about public records and a few things that your agency might want to be thinking about during these times. The governor's orders have not addressed public records, so on its outset, the requirements and rules for your agency have not modified. Nonetheless, it doesn't mean there aren't a few changed circumstances that we shouldn't be thinking about. Just as a reminder, what the definition of public records is all materials made or received by an agency in connection with the transaction of official business, which are used to perpetuate, communicate, or formalize knowledge. As all of you are likely aware, these things certainly include your email traffic back and forth amongst your staff and yourselves when those emails relate to the business of your district. But it's also important to remember that the courts have also ruled that things such as text messages back and forth and other sorts of electronic chat messaging features are also public records when, in fact, they are dealing with public business. This is important to note. We're at a time now when more and more of our staff are being asked to work from home, to distance themselves, to work from the field and not come into the office, that the tendency and temptation to work, to communicate via text message or some of these other functions is there, and that's fine, but we often discourage the use of text messages in more normal times because it's difficult to keep track of them. It's difficult to maintain them and transmit them. It's not impossible, but it takes some planning, and it's something to think about. So it's important to remind your staff, if you are having them work remotely, to keep to not delete text messages that come in, to do not delete emails that they send or receive at this time. And then also it's important to note that even if they are, many staff are being asked to work from their own personal computers or devices at home, that has no bearing on whether something is a public record or not. So emails sent or received from their personal computers are still just as amenable to open the public records laws. So those things need to be retained. So as you're having discussions with staff, if they are working remotely, we would advise you to remind them that it's their duty to keep track of these things, to keep hold of them, and for you to be thinking internally about when staff does eventually start returning back to the office, making sure that there's an opportunity to gather those public records, to store them, to track them, whether it's getting things off of people's phones or having them take images of all their text messages and send them to you, which can be onerous, or using their email. And again, that's why we still would encourage you and your staff to use email as much as possible, just because it's so much easier to track, to collect, and to disperse. So that's just one item just that we wanted to remind everyone to think about a little bit if their staff is dispersed. The second thing is, of course, with all public records, they are open to be inspected and copied by the public. Saving these things is the first step, but we the public records laws allows anyone to make that request of your district to see those records. And that can certainly be challenging right now when we're at a period of time when we are working to social distance, when people aren't all necessarily going into the office and can access it. So the typical requirement is that you are to permit inspection at any reasonable time under reasonable conditions, and that can obviously be a challenge right now. But I want to just quote briefly from the statute, and this is the Public Records 119.071C, which says, you must acknowledge requests to inspect or copy records promptly and respond to such requests in good faith. A good faith response includes making reasonable efforts to determine whether such a record exists and its location. So at this time, we would hope that whoever your designated public records custodian is, their email should certainly be posted on your website, and hopefully they're maintaining their ability to access those emails. And if there's a number to call in, that someone's able to monitor that call and receive those messages, we would be encouraging you to have your records custodian respond promptly. And that response can simply be, hello, we've received your request. We understand what you're seeking at this. We will make every reasonable effort at this time to gather those materials. However, in light of the current situation, and then you can describe what your situation is, on whether you have limited in-office staff, et cetera, and then promise them that you will continue to follow up, get back with them as soon as possible, et cetera. To the extent that you have their request is something that is electronic that you have access to, you can certainly provide a partial response to a public records request. There's nothing that says you have to give them everything you can possibly have all at one time. So you can certainly make that response as well. Here's what we have available at this time, and we can more fully respond to you once we are back at either full capacity or once we are back into the district. Oftentimes, many of our clients, their older archive records aren't electronic. They're hard copies in the file. There's simply no other way other than someone coming into the office to see them, to review them, is how they're going to have to be able to do it. But we would like to think that if you respond promptly, that you make the effort to assure them that you'll get back to them as quickly as possible, and then continue to follow up, that's the best that you can be expected to do at this time. So that's our two takeaways today on public records. Make sure you're coordinating with staff and reminding them that their correspondence with you about things that relate to business, even if it's a text message, even if it's an email from their home computer, these are public records and they should be retaining them at this time. And then also to remind your custodians, your records custodian, to reply as promptly as possible to any requests they get. But then just to, they can rely on the fact that they will make a good faith effort, and at this time, that may mean some delay in getting the records to them, and you should be fine. So that's our takeaway for public records today. So I will turn it over to Glenn Thomas and Jim Lynn to talk about employment issues.
Hi, this is Glenn Thomas up in Tallahassee. I'm going to go over two components of the Families First Coronavirus Response Act. There's the emergency paid sick leave portion and the Family Medical Leave Expansion Act. Both of these are in effect between April 1st and December 31st of this year. I'm going to provide some of the basics of these acts as well as many details as I can. On April 1st, the Department of Labor published 124 pages of regulations on these rules, so there's a lot of details that are covering these. So the first one is the Emergency Paid Sick Leave Act that I'll get into, and this is something an employee is entitled to 2 weeks, up to 80 hours of paid sick leave if the employee is not able to work because they meet one of 6 qualifying reasons related to COVID-19. Now, how much pay they're entitled to is going to depend on the reason for their inability to work, and it has to be one of these 6 qualifying reasons. The first 3, if an employee is unable to work because he or she is subject to a federal, state, or local quarantine or isolation order related to COVID-19. Number 2, if they have been advised by a healthcare provider to self-quarantine due to concerns related to COVID-19. Or number 3, if they're experiencing symptoms of COVID-19 and are seeking a medical diagnosis, that employee is entitled to receive either their regular rate of pay, the federal minimum wage, or a state or local minimum wage, whichever is greater. The most an employee can receive is $511 on any one day, or $5,110 over the entire 2-week period. If an employee is unable to work because he or she is, and these are reasons 4 through 6, number 4, caring for an individual who is subject to a federal, state, or local quarantine or isolation order, or an individual who has been advised by a healthcare provider to self-quarantine due to COVID-19. 5, if they're caring for a child whose school or place of care is closed related to COVID-19. And number 6, if they're experiencing any other similar conditions that may arise, which would be specified by the Secretary of Health and Human Services. If you're unable to work because of 4 through 6, you're entitled to 2/3 of your regular rate of pay, the federal minimum wage, or an applicable minimum wage at the state or local level, whichever is greater. And under those 3 circumstances, the most an employee is entitled to is $200 a day, or $2,000 over the whole 2-week period. It's important, I really want to emphasize this. The reason the employee is unable to work has to be one of those 6 qualifying reasons. It's not enough that the employee meets one of those definitions. It has to be the reason they're not working. An example that's given in the regulations is an employee who has been furloughed because his place of employment has no work for him or her to do. That employee is not eligible for emergency paid sick leave because the reason the employee isn't working is there is no work to do. So even if, for instance, the employee had symptoms of COVID-19 or had a child whose school was closed because of COVID-19 that they had to take care of, even though they meet one of those qualifications, they're still not eligible because that isn't the reason they're not working. This is it's going to be a technical issue, and it's going to depend on the facts and circumstances. And I would also I would note that when an employee comes up and says that they have to miss work because of one of those qualifying reasons, that would not be a good time to inform him or her that they are now being furloughed or laid off, because that appears like it's a reaction to their request for paid sick leave, which would be a violation. And this law is enforced under the Fair Labor Standards Act, so there is an investigation provision, there is a enforcement provision that you don't want to run afoul of. Now, who is a covered employee? What employees are covered under this? And that would be any employee who meets one of those 6 qualifying reasons. It doesn't matter how long the employee has been there or how many hours the employee works. If you have an employee, they are covered under it. Who is a covered employer? This would apply to any private employer with fewer than 500 employees and all public agencies. So how many hours of emergency paid sick leave is an employee entitled to? I mentioned that the maximum is 80 hours during that 2-week period. That is for a full-time employee. The most they would be entitled to is 80 hours. A part-time employee would be entitled to the number of hours that the employee works on average over a 2-week period. A substantial portion of the regulations is dedicated to determining, to calculating the number of hours worked on average by a part-time employee. And I would say look over the past 6 months to determine how many hours per week that the employee works. If it's a full-time employee that regularly works overtime, let's say the person has worked overtime every single week this year, I would count that overtime in their weekly average. So somebody's average may be, let's say their average is 50 hours a week. Now, they still are subject to the 80-hour maximum, so they might get 50 hours their first week, but then the second week, they'd only be entitled to 30 because that's the maximum. And that's the other issue is overtime. It should be counted for terms in determining the amount of hours an employee works, but it isn't used in determining their rate of pay. The rate of pay is their rate of pay. They're not physically actually working overtime, so they aren't actually getting an overtime time and a half bonus. The Emergency Family and Medical Leave Expansion Act, what this does is it creates a new category of family medical leave. If you are unable to care for a son or daughter under 18 because their school or their place of care has been closed, and that child care is not available because of COVID-19, they're entitled to paid family medical leave for 10 of the 12 weeks. The first 2 weeks are unpaid. Now, this is the same reason that is used for emergency paid sick leave, number 5 that I mentioned. So an employee technically could use those 2 weeks under emergency paid sick leave in conjunction with the family medical leave, and therefore their 12 weeks of family medical leave would be paid. But they also have the opportunity and the ability to, if the employee desires, to use whatever accrued leave they have during that first 2 weeks. The maximum amount of pay would be $200 per day and $10,000 total for the 10 weeks. And it's important to note that this leave is not in addition to regular FMLA leave. This is just simply a new category. So an employee is still only entitled to 12 weeks of FMLA leave per year. The difference on this one is that the 10 weeks of leave in this case is to care for a child due to school or daycare closure are paid. So if an employee has already used FMLA leave for some other purpose during the FMLA year, the amount of leave that's available is going to be reduced by that amount. Now, this one, there is a difference in the covered employee. An employee who has been employed for 30 days is going to be considered a covered employee. All public agencies, again, are covered under the FMLA expansion. In case you're wondering what an FMLA year is, that would be something that is your policy. It could be the calendar year. It could be starting January 1st, ending December 31st. It could be any other fixed 12-month period, such as a fiscal year, some year required by state law, or some year starting on an anniversary date. It could be a 12-month period measured from the date of an employee's first FMLA leave, or a rolling 12-month period that's measured backwards from the date an employee used FMLA leave. Again, this is probably an existing policy, and you'd have to check on that. I just do want to make sure that everybody understands, because I've had a lot of questions about it. The expanded FMLA leave only applies to employees who are unable to work because they're caring for a child whose school or their place of care has closed because of coronavirus. If their school or their place of care has closed for some other reason, they're not eligible. For instance, if school is closed because it's summer, then that would not be a reason that somebody's eligible for expanded FMLA leave. As far as what a place of care is, this is a little more broad than I originally thought after reading the regulations. It actually includes not only daycare facilities and preschools and before and after school programs, but it also includes summer camps or summer enrichment programs. So that has a pretty broad definition for somebody who's during the summer regularly sends their children to a camp during the day. Then if that camp is closed because of coronavirus, then that person would be eligible. There is an emergency responder exclusion for both of these acts. An employer may exclude certain employees if they are emergency responders. This was also defined under the regulations. What they say is, for purposes of employees who can be excluded from paid sick leave or expanded family medical leave, an emergency responder is anyone necessary for the provision of transport, care, health care, comfort, nutrition of patients, or others needed for the response to COVID-19. This includes, of course, who you'd expect: the firefighters, police officers, emergency medical services personnel, but it also includes public works personnel, people with skills or training in operating specialized equipment or other skills that are needed to provide aid in a declared emergency, individuals who work for facilities and employ those individuals, and whose work is necessary to maintain the operation, and other individuals who the state may deem as an emergency responder. So that's also a pretty broad definition of who an employer can exclude. Some other things that are important: an employee should document not only their reason that they're going to need emergency paid sick leave or family medical leave. They should give you the dates that they're requesting the leave, the qualifying reason for the leave, a written statement with some documentation, such as a doctor's note or some other documentation that just supports their reason. And these are requirements under the law and under the regulations that documentation is required. Employees are entitled to be restored to their same or an equivalent position when they return from paid sick leave or expanded family medical leave, so that should be noted. And finally, there should be a rights notice. There is one available on the Department of Labor website that should be downloaded and posted at your place of business. And also, if people are working remotely, it should be posted on your website. If there are no questions, I will turn it over to Jim Lynn for an overview of the CARES Act and Executive Order 20-88. Jim?
Hello, everybody. Jim Lynn here, and I am going to be talking about the Coronavirus Aid, Relief, and Economic Security Act provisions concerning retirement plans, and also the Governor's Executive Order 20-88 pertaining to reemployment of certain retirees under the Florida retirement system without having to wait for the 6-month and 12-month limitations on reemployment of retirees. So first, with respect to the CARES Act, this is the federal legislation, the big legislation, the $2 trillion package that was passed on March 27th. Included in that was several provisions which could provide additional options for members of governmental retirement plans. And specifically, it provides for tax-favored withdrawals from 401A, 457, and 403B plans. These are defined contribution plans in which members have individual accounts. The law allows members of these plans to withdraw up to $100,000 from their accounts, assuming they have that much in their accounts. But they have to certify that either they or their spouse or dependent has been diagnosed with COVID-19, that they have experienced adverse financial consequences as a result of being quarantined, furloughed, laid off, or unable to work, lack of child care due to COVID-19, or the closure or reduction of hours of a business owned or operated by the individual. It's also possible that the U.S. Treasury Secretary could determine that there are other criteria. And basically, the plan administrator of the plan can rely on the employee's certification that they meet these criteria, so that you don't have to go behind it, you don't have to request documentation. It's based on the employee's own certification that he meets one of these criteria in order to get the withdrawal from one of these defined contribution plans. If an employee takes a withdrawal for a coronavirus-related reason, the 10% early distribution penalty that normally applies would not apply. The employee would still be required to pay taxes on the amount withdrawn, but the taxes could be paid over a 3-year period beginning when the employee takes the withdrawal. And if the employee increases their contributions within that 3-year period and pays back to their plan the amount that they withdrew, there would be no penalty and no taxes whatsoever. So it would be like an interest-free loan in those circumstances. The CARES Act also provides for increased loans for the same type of criteria from 401k, 457 plans, and 403b plans, not 401a plans. And under the increased loan amounts, currently, under current law, plans can allow, they don't have to, they can allow members to take loans of up to $50,000. The CARES Act would increase that to $100,000. There's other limitations on those loan amounts that could be applicable. And I just want to make clear that the loan provisions are not a requirement. And so if your current 457 plan or 403b plan does not allow loans, then these loan provisions wouldn't apply. There is also in the CARES Act a temporary waiver of required minimum distribution rules. These are the rules that kick in when a retiree gets to age 72 and they have to start taking money out of their retirement accounts. And basically the law says that for this calendar year, 2020, you don't have to take anything out of your retirement account. In other words, the requirement that you take a portion of that money out for this year is waived. The other thing I'd like to talk about briefly is the Governor's Executive Order 20-88, which was issued on March 30th. And this executive order pertains to the Florida retirement system and to retirees who are designated as mission critical employees. And for those retirees, the governor's executive order tolls or waives the requirement that an employee be separated from all FRS employment for 6 months in order to be considered terminated and retired and get to keep their retirement benefits, and also tolls the 12-month period within which an employee cannot receive both his retirement benefits and salary from an FRS employer. In order for this to apply, the employee has to be in a mission critical category, which is law enforcement officers, first responders, emergency management, public safety personnel, health and medical professionals, and other critical response personnel as determined by a state agency head. However, the order also says that a FRS employer who employs people in these categories can also designate retirees that they want to rehire, even though their 6-month or 12-month periods may not have run. And under this order, they would not; those people would not have their retirements voided for the period of the emergency, not to exceed August 1st of 2022. Now, that doesn't mean that everybody who's rehired under this order could work until 2022, but that's the maximum amount of time in the event that the emergency extends that far, which we all hope it doesn't. And I know that we did receive some questions. I don't want to rush into that, but one of the questions had something to do with this, and so I'm going to go ahead and answer it. And the question was, I have 2 employees that will end their drop on April 30th and May 31st. Can we have them continue to work per the governor's order to maintain staffing? And as long as the employees fall in one of these mission critical categories, the answer is yes. You can. You have to, the district, in this case it's a fire district, would have to notify the Division of Retirement of the employees who were going to continue to be employed during the emergency. And again, the length of that employment would be limited to the duration of the emergency, which was originally set out in the Governor's Order 20-52, and not beyond August of 2022. The question goes on, how are they paid? They would be paid in the same manner as you pay your other employees in the same category. What about seniority? Are they considered a new employee? I think that would be up to the district to adopt a policy on how they're going to treat reemployed retirees. I think they would have the ability to adopt a policy that said that we're going to treat them as new employees, but in any event, I think that would be something the district could consider. And then it says, if so, how does it affect the 6-month, 1-year no reemployment? If they work 2 to 3 months for us during the pandemic, what happens to the current return to work clause? Well, the word in the order is tolled. It's tolled, which means if they end up working 2 or 3 months, and then they're no longer, the emergency's over, you no longer have to employ them, they wouldn't be employed, but that they would still then need to work 3 or 4, they would still need to be away from work, away from employment with all FRS employers for the remainder of the 6-month period. So this is a tolling effect, and the 12-month period works the same way. So in essence, the time that they worked during the emergency wouldn't be counted against them, but they'd still have to sit out the remainder of the 6-month period and the remainder of the 12-month period before they could come back to work. So, and I think there was another question for Glenn.
Yeah, I can take that, Jim.
Okay.
Yeah, this question is, there's an employee who, their wife just had premature twin babies, and the doctor does not want the employee to return to work because of the possibility of contracting COVID-19 and infecting the mother and the twins, which FMLA leave would he qualify for? This would not qualify for the expanded Family Medical Leave Act because that only applies to somebody who's the school or daycare for their child was shut down due to coronavirus. So that would not be this situation. They're still entitled, obviously, to regular FMLA leave, but I would say that they would qualify for emergency paid sick leave because that would apply to somebody who has been advised by a healthcare provider to self-quarantine due to concerns related to COVID-19. That seems to apply there, so that employee would be entitled to 2 weeks of paid sick leave. Like I said, that would just be to cover that 2 weeks. After that, FMLA leave would kick in. Whatever policy the city or district uses would be the one that would govern.
Thank you, Glenn. This is Kelly Erlacher. I just wanted to allow this time, if anybody has any other questions, you can use the chat function on WebEx. Again, you can click on your screen and you can either chat privately or chat to the entire group. I don't see any questions coming in right now. I also just wanted to thank everybody for their participation today. If you have questions at any time, you can email info@llw-law.com. That's info@llw-law.com. We have recorded this session today, and we will be circulating it to everyone. I understand that there were some folks that weren't able to join the call today because of the maximum capacity that we were at, so I apologize for that. I also apologize. I know that Chris Lyon was having some connectivity issues and he had to jump off the call earlier, but if you have any questions for him, again, you can email info@llw-law.com and I will make sure that he receives those questions. I do have one question that came through the chat. The question is there anything that covers firefighters who are instructed to self-quarantine by DOH, also not a workers' comp claim without a positive test?
I guess it would depend on like exactly who was telling them and what the reason for. If it was due to the fact that they were exposed and there's a healthcare provider telling them that they need to self-quarantine because of some concerns because they were exposed, then that would entitle somebody to emergency paid sick leave. But again, some of these are going to depend on some specific facts. I'm just speaking generally, and there may be other facts there that I'm not aware of.
All right, thank you, Glenn. I am not receiving any other questions at this time, so I believe that concludes our presentation today. Again, I just wanted to thank everybody for their participation. And again, if you have any questions, you can email us at info@llw-law.com. Do any of the speakers have any other final comments? All right. All right, everyone. Well, thank you so much, and I hope you enjoy your week.
Thank you, everyone.
Thank you all.